back to my channel. This is episode 6, and I'll be talking about the shift from first year to second year. And I thought first year was tough, but second year doesn't just test your knowledge, it tests your confidence, your time management skills, your ability to keep showing up when you feel like you're failing or you're falling behind. And you'll hear everyone, wherever you go, no matter what university you go to, you're going to hear people say second year is the hardest year. And that is 100% what I have felt. It just felt like from the minute I started back at university to the end of second year, it was just one big uphill climb. Continuation of your skill building. But I think one of the biggest things that will always make me giggle is that you can't use "I'm just a first year student" anymore. You're expected to know more, you're expected to do more, and a lot more is expected of you academically as well. So stay tuned, and we'll be talking about lots of talking points. So I want to do these videos a little differently this time round, a little bit different to how I did the first years. Is I'll briefly go over my second year experiences, and then each video will subsequently focus on a certain area. Again, making YouTube videos is very new to me. I'm just trying to find out what works and what doesn't. So just bear with me. I promise you the content will still come. So year 2 was a huge step up for me. And I mean, you couldn't use that excuse of being a first year student anymore. And you're expected to kind of have a more hands-on approach and be willing to learn and improve your skills. Yes, you do that in first year, but it's also really important that you kind of advance on that in second year. So my hub placement for second year was district nursing community. And you know what? It was a huge contrast from the acute setting to now to community, because in the acute setting, you've got buzzers going off, you've got people trying to pull you in from every direction. It's just like a complete whirlwind of emotions. Whereas in the community, there's none of that. You don't have buzzers going, you don't have people shouting at you, you don't have people saying, "Oh, nurse, nurse, nurse." You go in, you do your call, you provide the care, and it's preventative. Well, preventative and reactive, but they're kind of more focused on the preventative nursing, which is kind of what I got into nursing for. Looking at what I learned from my community hub, what a positive I can take from that is that you have one-to-one experience. So you have that one-to-one with your assessor, you have that one-to-one with the supervisors, and you get one-to-one feedback, which is invaluable. That really helped my learning. And what was really lucky for me is that I got put with a really fantastic assessor. Her knowledge was fantastic, and she wasn't shy to teach, she wasn't shy to give constructive criticism, and she wasn't shy to push you if she felt that you needed pushing. And some comments that I got from her when I did my final meeting was that I am working well above and beyond what's expected of a second year student and working within a third year approach. So that was really nice to hear. Some differences in working with different areas. So I got to work with the palliative care team, the Macmillan nurses, the advanced practitioners, the matrons that go around the care homes to try and keep people in the homes as opposed to admissions to hospital. And I got to work with the nurses in the care home team and in other areas. So I got to learn loads. It was really good for my decision making because I was making decisions in that call, which was fantastic. My spoke placements for this year was critical care in all my alternate fields. So what I mean by my alternate field placements is I had mental health, learning difficulty, and paediatrics, children's. So my first spoke placement was on a paediatric ward, which was split between a day unit where you had like day admissions that came up from the A&E department downstairs, or could get referred straight in from urgent care centres or GPs if warranted. You then had a bay of 6, which was your surgical, which was generally kind of like your tonsillectomies, your appendicitis, kind of your circumcisions, all these other things that kind of you'd expect to see with children. And then you had the admission ward further up. Now, I was extremely nervous about going into a paediatric setting because I don't have children, I don't know how to really communicate with children, I don't know how to play with children, I just don't know anything about children apart from an experience that I've had previously when a 2-day-old baby went into respiratory arrest while I was working in A&E. It was quite horrific, and obviously it left a really lasting impression on me, and it kind of really makes me nervous working with kids. However, I told my assessor this and she was fantastic. What I will say about paediatric nursing is they are extremely valuable members of the team, but it's not for me. And you'll come across this, you'll come to areas that you work in and you'll think, it's just not for me, but still give 100% of your effort and time to learn what you can from it. So I learned loads from this. And I'm really grateful and extremely grateful about how that changed my opinion on paediatric care. So my next spoke placement was at a mental health hospital, working with the community and intervention team. And what I mean by community and intervention team is that you have people come in for outpatient appointments and they speak to uh, the mental health practitioner or the mental health nurse and kind of have treatment that way. Um, when I say this was a huge learning curve for me, is I'm really passionate about there being mental health practitioners on rosters in A&E, just because working there myself, you just see a lot of mental health patients that come in and you're waiting for the patient liaison team to wait for all the medical tests to be done while that patient's in crisis. It just doesn't work. So I was really passionate to kind of see what they deal with on their end, and I took loads from this. Now, mental health nursing isn't for me, just because I don't think I could deal with people at their worst every day in regards of a kind of psychological, mental aspect as opposed to a physical, medical aspect. I just can't not take those things home with me, where I can kind of disassociate a little bit more on the medical side. I learnt loads. They were really willing to teach, and I did actually enjoy this placement, and it went really quick. And what was lovely is you didn't have to wear a uniform, so I really enjoyed that. My next spoke placement, moving on from that, was working at a learning difficulty um, centre that provided kind of, I'd say, respite daycare. Um, Now, if you're like me, um, and you've never been around learning difficulty before, you just have to have a really open mind and willingness to kind of engage and learn. People will get into your personal, and I found specifically people got into your personal space, but it's just their understanding and their way of greeting you. They don't really understand personal space as such. Um, Moving on from that, I learned loads and I got to meet some really amazing people, and the staff were lovely. Moving on from that, I then had my critical care placement for a 4 week period in the emergency department that I work in as a healthcare. So it was quite nice to be a student there because I knew everyone anyway, and the hospital emergency department where I work are just great with students in general. You get the odd one or two, but it's a busy environment. You understand it, you get it. I learned absolutely loads. I got to see some really interesting nursing interventions, medical interventions. I got to see chest drains. I got to see uh, sepsis treatment. I got to see ongoing CPR. I got to see the Lucas machines. I got to see manual CPR. I got to see drug overdose, just absolutely tons and tons and tons. And I just really wish that was my third year management because I would have absolutely loved that. Again, for nursing decision making, it just hit home how much you do not know. And that's okay because you're going to be constantly learning throughout these 3 years. And you just need to be receptive to that and understand actually, I'm a student, I'm here to learn. If I don't know something, my biggest advice to you is just admit you don't know something and say, I'm sorry, I don't know. But if you could tell me about it, that'd be great. And I can go off and read about it later on. Absolutely love my A&E placement. I just can't talk about it enough. It was fantastic. And then moving on from that, then it was returned back to my hub for my reassessment period. So I mentioned previously in a video about the university changing the structure of my second and third year. Now, when I say second year is an absolute uphill battle, it, my goodness, it just is an uphill battle. So we went back to university in September, and immediately it's straight into lectures, and quite heavy lectures because you're learning quite all new subjects. So we had a nursing intervention module, which was all about understanding nurse decision making and then applying interventions correctly. And then we had to do a presentation poster on this for our assignment. That was only 6 lessons long. So, you had, I say 6 lessons. So you had two lessons a week, and it was 6 weeks of that. So it was actually not very long, but I learned loads, and I'm really grateful for those lessons. Then we went straight into a decision making module, which is all about research. And as much as I whinged about research and didn't enjoy the module, having reflected on that, actually, it's really important because you need to understand where this evidence-based practice comes from. And for those of you that do become nurses, you'll come across articles that you'll need to know whether or not are reliable or are not reliable. So it was really useful looking back on it. And even now, going into my third year this September, I constantly use evidence-based practice and I look up for research because it just feeds your learning. Uh, I've got an exam in June to finish that module off, which is a decision making exam, which is 2 hours long. And I'm actually quite looking forward to it, which I know sounds really weird, but it'll be good. I've just submitted my reflective essay for my foundations of nursing and my EPAD reflection. So literally, second year is literally done. I've just got one exam left, and that's it. And then I can kind of focus on my extended learning opportunities, which will currently be a week simulation in June at the university on their new BIOS building, and then I will be looking at my international placement to Cambodia the following week after that. So I think each placement added another piece to the puzzle for me. And I now realise that second year starts asking you how to actually use those pieces fast. So, just be prepared for that really quick increase in knowledge, increase in learning, because it is an absolute uphill spiral. And if you can pass second year, third year will be a doddle. At least that's what they say. So I want to talk a little bit more about the pressures that I felt with in regards to clinical and academic stress. As I mentioned previously, you are expected to be more independent. This is expected of you, and you will find that your supervisors and assessors generally will start to take a step back. And it's not because they expect you to do more independently, it's to see what you can do and then where you need to learn and where you need to improve. I remember being in a call in community and my assessor didn't do anything and I just kind of cracked on and did it. And then I remember sitting back in the car and she went, "How do you think that went?" And I went, "Oh, I think it went okay." And then I said, "Well, you were really quiet in there, so I thought I'd done something wrong." And she was like, "No, I was really happy with what you were doing and I just thought I'd let you run the call." And then by the end of my 4 weeks, I was running a whole list independently with obviously my assessor chipping in if there were things that I didn't understand. And we'd always talk about a call before I went in and we'd always talk about a call before when I came out. So just be prepared for that independent working to be a little bit more kind of in the forefront of your mind and that your supervisors will start to take steps back. Patients rely on you more. And even if you don't always feel ready, patients will always expect you to know more than you know. So you just need to be really patient with that patient and with yourself. And please, 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 just if you don't know something, just be honest and say, "I'll go and get the registered nurse." There's no harm in doing that because I would rather I do that because I would rather just be honest with the patient, but I'm sure the hospital and the university would rather you just be honest. So, academic overload is absolutely crazy. There's more written work, there are tighter deadlines, and there's more complex assignments. Your judging shifts, your lecturers expect so much more of you so quickly. Your study time and personal life is just crazy. Your personal life is just non existent on this course. You need to really kind of put pressure on studying because there are some times when we've had assignments in my cohort that it's been very tightly put together. For instance, Christmas, we had 2 assignments due in the January, one in the beginning, one at the end. And they say, "Christmas, just take time off," but you can't not because you won't meet the deadline. So you kind of found yourself working kind of up to a certain point before Christmas and then after Christmas into the new year to make sure that you had them done. You just need to make sure that you have the kind of emotional intelligence and intelligence to just time keep and say no to things and focus on your studies. This is 3 years of your life, and you know what you kind of have an idea of what's to be expected of you, knowing that you're signing up for the degree. But when you're actually doing it, you kind of, well, I was absolutely exhausted by the end of my second year. It's just a complete uphill jump from everything else. And there are weeks where I felt like I was constantly behind, constantly chasing my own shadow, and constantly worrying about deadlines and not meeting them. Even being a meticulous planner, I just felt like I wasn't getting anywhere. And then it all of a sudden comes together. So you've just got to be patient, and I promise you everything will come to fruition. I want to talk a little bit now on what other students have taught me in my second year. And I'll talk about the advice and support that I've received from some third years and actually some first years Because believe it or not, you are going to come across first years that kind of may have already started the degree and then have taken some time out and then have started to come back. And don't kind of snub them off what their first years. Everyone has got something to give you, and I've learned that doing this course is that everybody's got something to give you, and it's really important that you take their advice, because sometimes they can give you some advice that you would never hear from anybody else. And I think that's really important, and that's something that I've learned in my second year. So some tips that they've given me that have changed things for me is quite a few third years kind of explain, what they've gone through in their second year, and if I need any help to reach out. A lot of third years will give you their email or their phone number, be like, just drop me a text, drop me a line if you need a hand or anything, and we can talk about it. Again, Wellbeing Wednesdays is a thing in the trust that I work for and the university that I go to, so you get to see a lot of third years, and they're more than willing to kind of share their stories going into their registration, etc. And obviously them sharing their stories as well makes you feel less alone. And especially when you're going to be going into your third year and they're just coming to the end and qualifying, it's nice to kind of get some hints and tips from them that have been through it. So I would really kind of advise anybody that's in your first year, speak to your second years, because they've been through the first year. They know what you're going through right now. And you will get a couple of second years and third years that just don't want to deal with it, which is fine. That's fine. But 9 times out of 10, you will always have someone that is willing to offer advice. So you'll get warnings, and you'll get warnings about other ward areas and other clinical areas, certain members of staff, other students. My advice to you is make your own opinions, make your own judgments. Don't judge a book by its cover. So I've had a story about a ward that was really bad with students. It was really horrible, didn't learn anything, didn't do anything. So I got myself all wound up going to the ward, and then I went there and it was great. I had a great time. I learned loads, I did loads, staff were lovely. So, people's experiences are their experiences. Make up your own. Don't listen to the horror stories that you will hear. I mean, obviously, there's no harm in being guarded, but just go in with an open mind and willingness to learn. I think most clinical areas will be happy with that. If I could say anything to my past self, having been where I am now, and I've said it in previous videos, is be patient, because it will come together when it's ready, and you will come together when you're ready. And don't be in a rush to get to the end point. As much as I would love to qualify and start earning a wage again, I'm not ready in any sense. And I don't think you're ever going to be ready. I'm not ready to go into third year. I'm scared. But it's a good, refreshing feeling, because I know that means that I'm kind of emotionally intelligent enough to understand kind of where I am in my learning. So what to expect for the rest of this series for year 2 is that I'm going to delve deeper into community nursing. I'm going to be honest and give you the realities of my experiences while I was working there, the pressures and the moments that stay with me, especially when it comes to meeting patients that I've met from the acute and then seeing them in a community environment. And they actually still remember you. So, it's quite nice sometimes to have that experience. I'll take you through some negative and some positive points of community care. I'm going to break down to you what second year burnout actually looks like, because my goodness, when I tell you I was tired, and it's not just me that's tired, the entire cohort was exhausted, because you just don't get a break. And then we'll talk a little bit more about how my confidence improved, imposter syndrome, and when it really kind of came together and I felt like for the first time towards the end of second year that I was actually doing what a nurse would do. And I think one of the most important things is that second year does not come with a manual. So maybe these next few episodes can kind of come together and offer you some advice and some guides to how you cope with second year. And my biggest bit of advice to you is lean on your colleagues. Lean on the guys that are going through second year with you, and then lean on the third years to help you get through it, because they're just fantastic. So until then, I'll see you.